have for you a sample from the diarrheal condition, which is cholera specifically, and I've identified 3 problems, which are dehydration, electro imbalance, and anxiety. So the first problem is dehydration. So my nursing diagnosis is as follows: dehydration related to projectile vomiting and effortless diarrhea in cholera, evidenced by sunken eyes, rapid pulse, and hypotension. Then my goal is to correct or restore the dehydration state of the patient throughout their hospital stay or after nursing interventions. Then my nursing intervention will be, I will give oral rehydration therapy continuously if the patient is able to tolerate anything orally, or I will give IV fluids like Ringer's lactate or normal saline rapidly in the critical stages of the condition to correct electrolyte imbalance and dehydration. I will continue to give both IV fluids and oral fluids once the patient has stabilized to increase weight gain, reduce dehydration, and maintain a constant or normal electrolyte balance. My evaluation: patient's dehydration state is slowly corrected, which is evidenced by reduced sunken eyes, reduced dry mucosal membranes after the nursing interventions and during their stay in hospital. So my second problem that I identified is electrolyte imbalance. That's my problem. Then the nursing diagnosis is electrolyte imbalance related to dehydration, evidenced by muscle cramps, tiredness, and fatigue of the patient. Then the nursing interventions include, I will give oral rehydration therapy to prevent severe dehydration because it is safe and effective in treatment of diarrheal diseases. I will give large volumes of fluids to the patient after diarrhea has subsided in order to maintain a balanced electrolyte level. Then the goal of this was the patients will be relieved of muscle cramps 30 minutes after the nursing interventions and more. And then the electrolyte levels will be balanced during the patient's stay in hospital and after nursing interventions. Then the evaluation: patient's muscle cramps, tiredness, and fatigue is relieved after nursing intervention, evidenced by patients verbalizing. So the last problem I identified was anxiety. So the nursing diagnosis is anxiety related to cholera, evidenced by the patient asking a lot of questions, restlessness, agitation, and incorporation to treatment. The goal of this is to relieve anxiety of the patient after giving appropriate IEC and during their stay in hospital. The nursing intervention is, I will give psychological care to the patient as to why they are being nursed in isolation. I will allow them to be visited by at least one relative once they have ceased vomiting and having diarrhea. I will ensure the ward is cleaned and disinfected to eliminate the fishy odor from the stool which causes anxiety. I will allow the patient to ask as many questions as possible about their condition and give them appropriate answers to allay anxiety. My evaluation will be, patient's anxiety will be allayed, evidenced by cooperation towards the healthcare team and treatment.